This is your Houston chiropractor, Dr. Gregory Johnson. We got David back in here with us, and he came back here for his second round of 2 adjustments a day for 3 days in a row. David's from San Diego, California, and he has had some cervical radiculopathy, which means pain out of his lower cervical spine that radiates all the way down into his left arm and hand. He's getting numbness and tingling in the C6 dermatome, C7 dermatome, and even into the C8 dermatome. He brought in an MRI that he had done since his last visit here, which was what, a year ago?
Yeah. Yep.
And it shows some fairly significant degenerative disc disease at C5, C6, C6, C7 primarily, which explains why he's having that paresthesia out into his left hand and fingers. They have done 2 epidural steroid injections on him since I've seen you, right?
Yes.
Which you said gave you some minimal relief, but not much. But then they recommend he have surgery, fusion surgery to boot.
2 levels.
2-level fusion in the lower cervical spine, C5, C6, C6, C7. And that's when David and his wife, who are both crack addicts, by the way, says time to come back to Houston.
Absolutely.
So would you mind sharing with them why you came back here to get adjusted versus having the surgical procedure done?
The way I felt when I went home the last time, after being treated last time, was better than I felt in years. And my wife has been watching me for a year, and I swear, I've been doing my exercises, I've been standing up straight, sleeping's a little harder, but she watched me get a little worse.
Progressively
over
deteriorate.
the last year, and started limping again. And
Time to get your ass lined up
yeah,
again, right?
Exactly. Yeah, she said, you got to go back because the way you were when you came back from that trip the last time, you need to go back.
And that was more effective for you than the epidural steroid injections that you had,
that
right?
treatment last year was more effective than anything that's happened to me in the last 10 years.
Well, welcome back, Charlie Brand.
Thank you.
All right, we've already done an initial assessment on him because it's been a year since he's been back here, so we always evaluate people when they come back in. Let's go ahead and have you close your eyes and bend your head forward and backwards for me again, David. I'm sorry, we already did this, but we have to show the crack addicts. Now, he has some pulling in his lower cervical spine. It radiates down into his left trap when he flexes forward. When he goes back into extension, that's when you really feel it bite down there, isn't it?
Yep, absolutely.
And then that radiates down into that left shoulder and arm and hand. He's got cervical subluxations, which include the degenerative disc disease at C5, C6, C6, C7. Thoracic spine and ribcage subluxations again. He's got a few down in his low back and pelvis here again as well. Now, he's also had surgery. It was at the left hip.
Left hip.
Yeah, he fractured his femur head in 2014, correct?
That is correct.
And they've
Veterans Day.
they fused that with a rod, right?
Yes, sir.
Big screw and rod.
L-shaped bracket.
Yeah, and we've
bunch of
adjusted you
vegetables.
since you've had that surgery, and that didn't bother it, did it?
Absolutely not.
Okay, so I've already done his exams. He's cleared for adjustment. So we're going to put him on the ring dinger table first. Would you say the reason that you're coming back here for chiropractic care is because of the uniqueness of the XYZ adjusting techniques that I utilize?
Absolutely. I've been to other chiropractors, and I come back Monday, Wednesday, and Friday
Forever. Yep.
And I got, it's been like 10 and a half months, 11 months, almost a year out of this last adjustment here.
Yeah, they last a lot longer, huh?
Yeah.
There we go. And they got plenty of chiropractors out of San Diego too, huh?
They do.
There we go. You forgot how tight I put them in there, huh?
Yeah. Can't get it in the
Yeah.
last one.
There we go.
I may have
Don't
gained
tempt me.
overweight since the last time.
Don't tempt, haven't we all? Deep breath. There you go. Yes, sir.
Yeah.
Welcome back.
Hurts so good.
Yep. So in adjusting the lower cervicals here, you notice I put his head in a little bit of flexion to open up the IVS in that and still adjust him P to A with the Palmer diversified rotary brake. You okay?
Mine is one.
Yeah, cool. Okay, let me help you up sideways. There we go. Okay, let's come back over here and you tell me now. Legs are even, they stay even. That's still tightened up in his lumbar spine and pelvis though, so that's a positive knockless test. Yep. Made work for him, aren't you? Aren't you, David?
Locked up pretty good.
Yes, sir. See if this one tightens up as much as that previous one.
It did not.
Good. There it is. I'm sorry. I know these are sore. Let's go bring it back. I still got to push them forward to get them away from the IVF. Yep. Now let's have a quick look for him, shall we? You didn't forget how, did you?
I did not.
Me neither. There you go. He's your last shoes right there. There you go. This is my ring dinger from the bottom end.
Yeah. This is the best.
Very good.
Oh.
Super duper. Okay, let's hit Jeff face that way. There we go. Yep. That left one's a little tender, isn't it?
It is.
Yep. Ooh, Crackhead's gonna love you again, David. Did we do a video on you last time you were here?
Yeah.
Yeah.
Okay.
Yeah.
Do you remember the name of it?
I don't. I know that there was a lot of Charlie Brown comments.
Yeah. I was gonna say you have the same shirt on.
I keep my fans happy.
There you go. Cool. All right. I'll stand over here in front of the mirror now.
All right.
Well, already you set it up better. You see the difference already?
I do.
I'm gonna stretch these guys out first. Mm-hmm. Okay, so now let's pull these guys here, way back this way. Yes, sir. Now, when you go forward and backwards again, see if it pulls as much and kinks up as much.
No, going down those bodies. A little
Right
bit.
there at the
A little
end?
bit, yeah, right at the end.
So when you go backwards, that's called extension, and that closes down the IVF, the intervertebral foramen, which is the opening where the nerve comes off of the spinal cord out of the cervical, all of the spine levels really. But that's his affected area, and with David's permission, we'll follow up his videos tomorrow on Wednesday, and you can see the progress, and he can tell you about his progress day by day over the next couple of days. Is that all right?
Looking forward to it.
Yeah, same here. Welcome back, Charlie Brown.
Thank you.
This year's Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with David all the way from San Diego, California, back for a tune-up. We'll see y'all soon.